Well, it's great to be here. I'm with Dr. Erin Moore, the Director of Vascular and Endovascular Surgery at Baptist Medical Center, and great to be with you. Welcome to First Coast Living.
Thank you. It's good to be here.
Yeah, so one thing that struck me as I walked in your office, you have all these really big books, but you took all these hard to understand terms and what exactly vascular and endovascular means, and you made it easier to understand. So tell us more about what you do.
So as a vascular surgeon, I take care of blood vessels, whether they're blocked, whether they're aneurysmal, which means they're dilated, or they have other sort of disease processes going on with them. We take care of those. I don't work on the heart. I work on everything outside of the heart.
Okay, that makes sense. So tell us more about heart failure and specifically systolic heart failure.
So systolic heart failure is essentially pump failure. Your heart is a big pump to pump blood both to your lungs and then oxygenated blood to the rest of your body. When that largest ventricle, the left ventricle, is starting to fail, it doesn't work well as a pump, and so what happens is it's not pushing that blood out and into the rest of the body effectively, and that fluid starts to back up, and where does it back up? Into the lungs. So the idea of congestive heart failure means that your lungs are becoming congested with fluid, and it's sort of like breathing through a wet napkin. You really struggle to try to take a breath.
So you said there's a big difference when patients come in to when they leave. You see a big difference this new therapy is. So tell us more about how you're helping patients.
Sure. So Barostem therapy, the idea is to try to use the body's own native inherent nervous system to try to reprogram how it deals with fluid, pressures, volumes, and that sort of thing, and the pump itself. So in days of old, like we do even now, we give a lot of patients medications to try to make their pump stronger, to offload the extra volume they have in their blood vessels, or to decrease their blood pressure so their pump has to work against less of a load. That works in some patients, but not in all patients. And in some patients, they're on very high doses of those medications, and it's really refractory. They just don't get a very good, effective outcome. And so in those situations, they continue to have shortness of breath. And little things like activities of daily living, the ability to actually go and take care of themselves and do even the most basic things for them can become a Herculean effort. And that's really a struggle for them. This actually provides a way to try to overcome that and maybe give them the functional status back that they haven't had previously.
And we were talking before, you said you're seeing some amazing results from this. Show us the little contraption you have that makes such a difference.
Sure. So this is the Barostem electrode. So if this is the carotid artery, and it runs right behind the strap muscle here in the neck. Okay. What we're doing essentially is through a very small transverse incision in the neck, right at the bifurcation or the split point to that artery. We go down there, identify that split point, and we put this little electrode. This is an electrode that's not been mounted to the patient. And you see how small it is relative to my fingernail. We're putting that on that location right at the split point, and in doing so, what that does is then gets tunneled along over the clavicle or the collarbone down onto the chest wall, and there is a sort of a stimulator, if you will, that goes onto the chest wall, not unlike a pacemaker, that is under the skin. Everything's then closed up. This is plugged into that pacemaker, and what it does is send a signal to the carotid artery to tell it, okay, your pressure is here instead of here. And it will reprogram the way that your body thinks and acts as it relates to your pump. And so what we're finding is that these patients come into us and they may roll in a wheelchair because they can't make it even from the elevator to come see us, but when they come back and follow up, they're walking in. And they look happy, and they look like they've got some of their life back. And we're not necessarily going to turn people into marathon runners, but if we can allow them to do the basics of their own activities of daily living, that's a huge, huge liberating thing for them.
As a doctor, how does that make you feel?
Terrific.
Makes you feel great.
Terrific.
And how would a patient know they're in need of this?
Well, so they're probably already identified as a congestive heart failure patient. Maybe they're being managed by their cardiologist already. Maybe they've been on escalating doses of their medications and it's still not working for them. They find themselves repeatedly back in the hospital emergency room because they're short of breath and they need to be offloaded and they need to be managed and brought in as an inpatient. Doing something like this will hopefully help them to get farther and farther between those times where they need to be admitted, if at all, and make it easier for their cardiologist to manage their heart failure.
Okay, very good. And do you have any advice for these patients as far as the whole process goes? Is it an easy process? What should they do?
So if you are a congestive heart failure patient, you're being seen by your cardiologist, you are struggling with trying to get this done, it's worth talking to your cardiologist to say, is there another option for me? And is this potentially a way that I could go using some sort of stimulator therapy like a pacemaker in a different way to try to help me to manage my congestive heart failure more effectively?
And it's an easy procedure. They're not in the hospital for a long time with this. How long does it take to actually do the surgery?
Procedure itself takes me about 30 minutes,
Wow.
and they go home the same day.
Okay. Very good. Well, we really appreciate you being on the show, and we'll get the word out on this exciting new contraption here to help folks with heart failure and systolic heart failure.
I greatly appreciate it.
All right, thank you. That was Dr. Erin Moore. And of course, head to our website, firstcoastliving.net, for more.